After going through this module, you will be able to know the definition of forensic dentistry and its scope. This module will let you know the history of forensic odontology, bite marks, and additionally you will be knowing the human dentition. Forensic science is a wide area and it is commonly defined or known as the application of science to the law or legal matters. In today's world, this area is much widely known to the general public thanks to the series like CSI and Forensic Files. However, it is also misunderstood due to this pseudo real life cinema drama. When the real life judicial system needs science to get involved and solve the case or any particular question regarding the evidence, the only person who is called in by the court to bring justice with the help of science is often a forensic scientist. The forensic scientist may qualify as an expert on the basis of education, background, or on the basis of his or her study. The forensic science has many branches, it has many fields, among which is forensic odontology. The forensic dentistry, or the more professional term, forensic odontology, is the application of dentistry to the law. This specialized area of dentistry includes the steps like gathering and interpretation of dental and related evidences. The forensic dentist is often an expert in civil or criminal disputes where dental injuries are at issues or there is a question of dental malpractice. Legal cases relating to injuries to the teeth, mouth or jaw may usually involve the expertise of a forensic dentist or odontologist. A qualified dental expert can provide opinion on issues related to the loss or damage to the teeth. For example, in criminal cases, the forensic dentist will assist the judge by relating expert testimony concerning a dental identification examination or by identifying bite marks and giving an opinion as to who may have made bite mark. Dental identification of a person from dental records by a qualified forensic dentist has long been established and accepted by court as a means to prove the identity of an individual. Forensic odontologists may now have started helping in establishing the identity of a deceased in case of mass disaster such as airplane crash, natural disaster, or where multiple people have died in fire disaster. Age determination of a person using dental evidence have become necessary. It may help in cases where question arises as to a person's correct age. Typically, if a person is accused of a crime, it may be significant to determine if the individual is a minor and therefore subject to juvenile court jurisdiction or whether the person has reached adulthood where he or she would be prosecuted as an adult. So students, now I will define forensic odontology. Forensic odontology is defined as the application of dental expertise to legal system or for the purpose of law or justice. The scope of forensic odontology, it includes the identification of unknown remains by teeth, jaw and craniofacial bones, analysis of orofacial trauma associated with personal abuse, dental jurisprudence and research for new technologies. Next, I will tell you the how forensic odontology developed or the history of odontology. W. Eckert, in his book Introduction to Forensic Science, stated that use of dental knowledge for the purpose of identification goes back to 66 Anno Domini and proposed that it is said that the first dental identification was made between 49 and 66 Anno Domini when Agrippina, the jealous wife of Roman Emperor Claudius, demanded the disembodied head of her husband's mistress. A discolored anterior tooth or malocclusion served to confirm her identity. Folklore also ascribes the first use of bite mark identification to King William, who was the conqueror circa 1066 Anno Domini, whose habit was to secure his mail with sealing wax imprinted with his bite. His anterior teeth were malaligned, thus allowing verification of the authenticity of his document. The list of famous monuments in forensic dentistry it include: in 1453, Swanson in his forensic dentistry, he told, first formally reported dental identification was of a fallen soldier who was John Talbot, who was identified following the Battle of Castellon. Then in 1692, first bite mark case in a criminal trial. Reverend George Borrow was accused of witchcraft in Salem, Massachusetts. Bite marks on the wrist of a female were claimed to be his. The fact that Burroughs was imprisoned when the bite mark appeared was not an adequate defense and Burroughs was hanged. The case did little to advance bite mark science. In 1776, it was reported by Lunch in Handbook for Dental Identification, Technique in Forensic Dentistry that first dental identification by dental profession, dentist patriot Paul Revere identified his friend and patient Dr. Joseph Warren, who was killed in the Battle of Bunker Hill and interred in an unmarked grave. The exhumed body was identified by a prosthesis recognized by Revere. In 1914, first dental identification in a criminal case was done. Mrs. McAllister's body was robbed from the grave. This common practice in 19th century Scotland supplied corpses for medical school anatomy class. The identification was confirmed by Mrs. McAllister's dentist, who fit her newly constructed denture on the maxillary ridge of the corpse. Subsequently, his conclusion was proven incorrect. This case was reported by Harvey W. in his Dental Identification and Forensic Odontology. In 1837, it was Miles AEW who reported in his Dentition in the Estimation of Age that Dr. Edwin Saunders was known to establish the eruption sequence of teeth as the criteria to determine the legal age of children for England's child labour law. Then 1878, first mass disaster in which dental evidence was used to make identification was the fire at Vienna Opera House. Following it, in 1897, fire at the Bazaar de la Charité in Paris, 126 perished, some of whom were identified by dental means. This resulted the first textbook of forensic dentistry by Dr. Oscar Amadeo, who was considered the father of forensic odontology. In 1952, first US bite mark case resulting in a conviction, Doyle versus Texas. Doyle was convicted of burglary based on his bite mark in partly eaten cheese found at the scene. In 1950s, increasing use of dental identification as a result of World War II, the Korean War and mass disaster. In 1970, formal international and American organization in forensic dentistry was established. In 1980s, computer programs were designed for forensic dentistry, particularly for mass disasters, war casualties, and national tracking of missing persons and unidentified dead. Then, in 1990, organized forensic dentistry developed and formalized guidelines and standards for identification, bite mark management, and mass disaster. There is increasing emphasis and awareness of dentistry role in domestic violence, that is of child, spouse, and elder abuse. Famous and notorious figures identified through forensic dentistry: John Wilkes, Adolf Hitler, Martin Bormann, Eva Peron, Joseph Mengele, Lee Harvey, and Nicholas II and family were the prominent figure who identified through forensic dentistry. So students, now I will tell you about human dentition. The adult human dentition, it consists of 32 teeth arranged in two arches, one arch in the upper or maxillary jaw and one in the lower or mandibular jaw. Since the arches are symmetrical, each quadrant contains the same number and type of teeth, and it includes two incisors, one cuspid, two premolars and three molars. Incisors are the wide front teeth with flat, thin biting edges. The cuspid or eye tooth is the corner of the arch and has a pointed cusp. Each premolar typically has two cusps. The molars have 3 to 5 cusps and a wide biting surface to chew and crush the food. The third molar or wisdom tooth is the last tooth in the arch. Each tooth has a crown and a root. The crown is the visible portion that protrudes above the gum. The root is embedded into a socket in the jaw. Incisors and cuspids each have a single root. Premolars have one or two roots and molars usually have 2 or 3 roots. The crown of the tooth is capped by enamel, which is the hardest tissue of the human body. Under the enamel, there is dentine, which comprises the bulk of the crown and root. Unlike enamel, dentine is alive and capable of transmitting pain. In the center of the tooth, there is a cylindrical canal of soft tissue which is referred as pulp. The pulp's function is to sense pain, and throughout the life it slowly produces dentine, which narrows the diameter of the pulp canal as the individual ages. The root is surrounded by a thin layer of bone-like tissue called cementum. The fibrous tissue called the periodontal ligaments holds the tooth in the jaw because it is embedded into both the cementum and the bony socket wall. By convention in the US, dentists identify individual teeth by the universal system, which number the teeth from 1st to 32, starting at the upper right third molar across to the upper left third molar, and then continuing with the lower left third molar and concluding with the lower right third molar. Each number refers to a specific tooth bearing its own specific anatomy. Even though some teeth look alike, but a dentist can examine an isolated, extracted tooth and he can determine its correct number in most of the cases. Other countries, they use different tooth numbering system. Children, they have 20 teeth, which is called deciduous or primary teeth. They have no premolar and no third molars. These teeth begin to erupt at the age of 6 months and are completely erupted by 2.5 years. Primary teeth are lost and replaced by the permanent teeth starting at the age of 6 or 7 years. In the universal system, primary teeth are designated by letters from capital A to capital T. The surface of teeth are named as the surface which faces the outward toward the face, lips and cheek. It is referred as facial, labial or buccal, whereas the surface which faces inward toward the tongue is termed as lingual. The biting surface is called incisal when referring to the front teeth and occlusion when applied to the premolars or molars. The side of the tooth facing the midline is called the medial and side away from the midline is distal. Now, I'll be talking about bite marks. First, I will define what is bite marks. Bite marks represent patterned injury in skin produced by teeth. Those of forensic significance most often accompany violent crime such as homicide, sexual assault, child abuse, domestic violence and burglary. Bite marks can also be inflicted by animals, most notably dogs and cats. Now, you will be knowing what is the forensic significance of odontology. Each human dentition is unique, differing even in identical twins. Its imprint in skin can show this individualization. Accordingly, perpetrator identification is possible. For this reason, bite marks have been referred to as dental fingerprints. The analogy is superfluous. Bite marks seldom mark with the rubber stamp accuracy expected with fingerprints. Yet, in some ways, bite marks are more valuable. Fingerprints found at a crime scene, it indicate only that a suspect was there. They do not imply criminal activity or a time relationship to the crime, but the bite marks suggest an alteration between the victim and perpetrator, and their temporal coincidence to a crime can be determined. When a suspect claims that intercourse was consensual or when the sole caretaker of a child alleges that the fall was accidental, the presence of a bite mark suggests otherwise. Now, I will tell you the description of a typical bite mark. A typical bite mark appears as a circular or oval injury measuring 3 to 5 cm in the widest diameter. When complete, it is of 2 separate curved arches. Sometimes partial bite marks are also found. They may be present abrasions, lacerations and depression corresponding to the size and shape of biting surface of human front teeth. In the case of well-inflicted bite, the incisors are normally recorded as linear rectangular marking, while the canines are recorded as circles or triangular markings. Variations in the bite marks. The bite marks are not simply mechanical tool marks. The act of biting with ensuing struggle causes the unpredictable distortion. Factors that influence the appearance of mark include the anatomical location and composition of the skin, the position during biting, the direction and force of biting, as well as age, gender, systematic health of the victim. These variables allow bite marks to display a variety of forms and deviant patterns, the most common of which include central contusion, sunburst pattern and avulsive bite and multiple bites. First, we will talk about the central contusion. This is the area in the center of the bite mark and has long been attributed to suction and or tongue thrusting. While this is true of some cases, central contusion can also result from the pinching of skin between teeth. Whereas sunburst pattern, it is the radiating abrasions or contusions that are often seen near the periphery of the mark, oriented perpendicularly and radiating outward toward the center. Some of these represent drag marks indicating where teeth scraped along the skin before or after they took hold. Whereas the avulsive bites, these are particularly vicious bite that may tear out a section of tissue, leaving an ovoid gaping laceration with torn, scalloped edges. In case of multiple bites, the bite marks can be multiple and superimposed. These are often seen in non-felonious assaults between children at play. Single-arced bite or one-sided bite. These are occasional reports of bite marks showing only one arc. In such cases, the dynamics of biting, superimposed clothing and other factors can explain this phenomenon. A bite can also show only the right or left side of both arches due to such factors as uneven biting force, skin curvature and absence of teeth or tooth placement during bite. Whereas the toothless bite mark, it is a simple ring of homogeneous contusions approximating the size and shape of human arches but not showing individual tooth mark that should be recognized as a possible bite marks. Sometimes tooth marks are present but indistinct, appearing as fused, scalloped area within a continuous curvilinear contusion. Occasionally, tooth marks or arc configuration are obscured by massive contusion around the bite marks. So students, now let us see what we have studied in this module. The forensic dentist is often an expert witness in civil or criminal disputes where dental injuries are at issue or there is a question of dental malpractice. Legal cases relating to injuries to the teeth, mouth or jaw may involve the expertise of a forensic dentist or odontologist. The adult human dentition consists of 32 teeth arranged in two arches, one arch in the upper maxillary jaw and one in the lower or mandibular jaw. Each quadrant contains the same number and type of teeth, which include 2 incisor, 1 cuspid, 2 premolars and 3 molars. Each tooth has a crown and a root. The crown is the visible portion that protrudes above the gum. The root is embedded into a socket in the jaw. The crown of the tooth is capped by enamel, the hardest tissue of the human body. Under the enamel, there is dentine, which comprises the bulk of the crown and root. By convention in the US, dentists identify individual teeth by the universal system, which numbers the teeth from 1 to 32, starting at the upper right third molar across to the upper left third molar.